Now I'd like to continue our discussion in Chapter 7 by looking at the bones of the appendicular skeleton. Again, the appendicular skeleton is composed of the bones of the upper and lower limbs as well as the girdles that attach those bones to the axial skeleton. We're first going to look at the pectoral girdle, which is the girdle involved with attaching the upper limbs to the body. And then we'll look at the pelvic girdle, which consists of the hip bones. Its job is to secure the lower limbs to the body. There are two bones that make up the pectoral girdle on each side of the body. The first bone is the clavicle, and the second bone is the scapula, and that's shown here in the picture. The clavicle connects to the manubrium, the portion of the sternum in the front, and connects in the back or the side of the body to the scapula. The scapula is what we know as our shoulder blades, and it is actually what forms the cavity for the first bone of the upper arm to attach into the body. When we look at the clavicle to me appears to look sort of like a stretched out S. There are only two parts of the clavicle that you would be responsible for identifying, and that would be the acromial end and the sternal end. Just by looking at these words, you should be able to tell which portion of the body they are going to be located. The sternal end of the clavicle is really blunt and flat. That is going to be the portion of the clavicle that connects to the sternum. The other end of the clavicle, the acromial end, tells us that it is going to connect into the acromial region or the shoulder. The acromial region is the region that has more of a fan shape. As we look at the scapula, it's a much more odd-looking bone. It has a few different portions you're going to need to know the name for. The reason it has such an awkward shape, we'll learn as we get into Chapter 10, is so many different muscles from different angles of the body can attach. When looking at the scapula, you should first orient yourself by finding the spine. This is the spine. That is the large, what looks like a spine sticking out of the bone. Connected to the spine is the acromion. And on this top picture, you can see a little bit of the acromion here. Opposite the acromion is another large process that sticks out called the coracoid process. And if we look up at the top, this would be the coracoid process. The acromion and the coracoid process boundary the cavity called the glenoid cavity. The glenoid cavity is the portion of the shoulder blade that the upper arm bone called the humerus is going to attach. So when we're looking at this picture, you should be able to identify those portions of the bone regardless of which orientation the bone is facing. Okay. Now let's look at the bones that make up the upper limb itself. The upper limbs are actually composed of about 30 bones, but we're not going to learn every single one of those in extreme detail. We're going to look at the brachial portion of the upper limb, which is made of the humerus, the anterobrachial portion of the upper limb, which is composed of the radius and ulna, and then we will look at the hand. The hand is composed of carpal bones, which make the wrist, metacarpal bones, which make the palm, and then phalanges, which make the fingers. We first take a look at the humerus. The way I can always identify the humerus from other long bones when separated from the put together skeleton is I look for the large rounded portion on one end. This is the head of the humerus. This is going to be the portion that fits into the glenoid cavity on the scapula that we just located. The other end of the humerus, this would be the more distal end of the humerus, to me looks like someone has brought up a fist and you're looking at their knuckles, and then you got kind of your middle finger poking out a little bit further, like that knuckle's a little bit bigger. That piece that looks like it's poking out a little extra, that is called the trochlea. On one side of the trochlea, you have the medial epicondyle, and on the other side, you have the lateral epicondyle. Attached to the lateral epicondyle is a very large, smooth piece called the capitulum. The capitulum is where the ulna, one of the anterobrachial bones, is going to attach and form a nice movable joint that forms our elbow. Okay. So again, this is the humerus, a long bone, one rounded end, more proximal, more distal end, a cyst of knuckles. Now, flipping past the words, let's look at the bones that make up the antebrachium. We have the radius and the ulna. The radius is here. It has one fan-shaped end and one really blunt, flat end. Another thing that helps me identify the radius is you have what we call the radial tuberosity. There's what looks kind of like a knot near the head or the blunt end of the radius. The ulna is very easy to identify, although it's kind of hard to see from this view. The ulna is a long and skinny bone. On the more proximal end, or the elbow joint of the bone up here, there's something called the olecranon process. The olecranon process forms what looks sort of like a C. That is going to be the portion of the ulna that wraps around the capitulum to help you form the movable joint of your elbow. The reason I use the olecranon process to help me identify the ulna is if you flip the bone on its side, what looks sort of like a C becomes a U, which of course is what the word ulna begins with. Within the olecranon process is something called the trochlear notch. The trochlear notch is actually what the capitulum is going to rub or move into as you form your elbow joint. Now if we look at the hands, what I would like you to be able to do is not name every individual carpal, metacarpal, and phalange, but be able to identify the difference between these three bones. Looking at this picture, you can see both of these are going to be the most distal ends of the radius and the ulna. Attached there are several, I believe 8 short bones that make up your carpals. Each of them does have an individual name, but we're not going to focus on that this semester. However, if I pointed to any of these short bones, you should be able to tell me that these are one of the carpals. Then going more distal, moving into what makes up more the palm and body of our hand, we have 5 metacarpals. And then going further out, on each finger except the thumb, we have 3 phalanges. On the thumb, we only have 2 phalanges. The phalanges and the metacarpals are long bones. The carpals are short bones. Now we move down to the inferior section of the body. We're going to look at the pelvic girdle and the legs. The pelvic girdle is made up of your hip bones. These are more technically called your coxal bones. The coxal bones are formed by the fusion of 3 bones. To make this a complete circle, to form the bottom portion of your body, the 2 coxal bones connect into this guy right here, which is, if you recall, is the sacrum, which has the coccyx attached. So don't let the picture confuse you. The sacrum and the coccyx are not part of the coxal bones. They are not even part of the appendicular skeleton. If you recall, we covered the sacrum and the coccyx when we were going over the axial skeleton. They are a portion of the vertebral column. From about this area here down to here, this is the first bone that makes up a coxal bone. This is the iliac bone, okay, the ilium. Then if we go a little further down, that forming the more top part of the bottom rim, this is the pubic bone, the pubis. Then going down further, making sort of a loop on the very bottom portion of the coxal bone, this is the ischial bone, the ischium. So all 3 bones fuse together to make the coxal bone. Ilium, pubic bone ischium. The two coxal bones are connected at the bottom by a piece of fibrocartilage known as the pubic symphysis. Where they connect at the area of the pubic symphysis forms a pubic arch. This is one easy way to identify whether you are looking at a male or a female hip pelvic girdle. The pubic arch here is going to be much wider or larger in degrees than the male will. And that simply has to do with the shape of the female body, that it needs to allow a baby to pass through the birth canal when necessary. A few markings you need to identify on this bone would be the iliac crest. That's the upper portion of the ilium here where it protrudes out. Then coming further down, there's the iliac spine. A nice, smooth, indented cavity called the acetabulum. This acetabulum is going to be where the upper leg bone, the femur, hooks into the girdle. Okay. So now, let's go a little further down, and let's look at the lower limb. The lower limb is composed of 3 bones. 2 of them are very large and carry most of the weight of the body. Then we have the foot, which is made up of different series of bones that we'll see are very similar to the bones that make up the wrist and the hand. First, if we take a look at the femur, this is the largest and strongest bone of the body, but don't let that confuse you with the most weight-bearing bone. It is not the most weight-bearing bone in the body. It's just the largest bone in the body. The femur is fairly easy to identify because the head of the femur has such a large neck region and it protrudes out of the bone. The head of the femur here is what will hook into the acetabulum of the hip bones, forming the hip joint. At the top of the bone, near the head, is the greater trochanter, and then below the head is going to be the lesser trochanter. At the most distal end of the femur, we see 2 large regions that are nice and smooth. These are the condyles. The condyles are going to help form the joints that make up the knee. The medial condyle is going to be on the same side as the head. The lateral condyle is going to be on the opposite side of the head of the femur. Sitting in front of the knee joint is a sesamoid bone called the patella. This is what the kneecap looks like. Now going down to the bones that make up the lower leg, we have the tibia and the fibula. And it's very important that you can remember that the smaller word, the tibia, goes with the biggest bone. The longer word, fibula, goes with the smallest bone. The fibula is a very, very skinny, non-weight-bearing bone. The tibia is an extremely thick, weight-bearing bone of the body. These small bumps right here that you can see on the front of the tibia, if you reach down and feel the little knots right below your knee joint, you will be able to feel those bumps on the bone, and you'll know where we are on the body. Looking down at the bottom, these are a few regions you are going to be able to be responsible for identifying on the tibia and the fibula, the medial malleolus and the lateral malleolus. Now if we look at the foot, you'll see we have a similar setup to what we saw with the hand. We have the bones that make up the ankle joint and a large portion of the foot. These are all short bones. All of these are called tarsals. There are 2 I would like you to know the name of, and one of them is the calcaneus. That is the heel. And then this is the talus. The talus is where the tibia is actually going to attach to make your ankle joint. All of our tarsals are short bones, and then as we go further to the end of the foot, we see a similar pattern to the hand, 5 long bones. These are metatarsals. And then what makes up our toes, we see 3 phalanges on each toe, except the big toe, just like the thumb. You only have 2 phalanges. The phalanges and the metatarsals are long bones. Now that we are finished with Chapter 7, I highly recommend that you now open up what I call the Bone ID PowerPoint and go through this PowerPoint. Make sure you can identify all the bones as you look at these unlabeled images. It is very good practice, and you are going to see things similar to this on your exams, but especially on your practical. So it's a very important thing for you to quiz yourself on.